Hi, I'm Rob McGarrah. I'm one of the Duke Cardiology Fellows, and I have with me here Dr. John Guyton from Duke. We're going to be discussing the results of the Odyssey Alternative trial, which was presented today as a late breaker at the American Heart Association Scientific Sessions. So, Dr. Guyton, one of your colleagues presented the main results of this trial this morning. Would you be able to review the results for us?
Well, there were three main results to the Odyssey Alternative trial. This was a trial in patients with statin muscle intolerance. And muscle intolerance is about 90% of the intolerance that you see with statins. It was limited to those patients with complaints of muscle intolerance. They had to have taken at least 2 statins and stopped both of them. One of those statins at the lowest available dose. It was a fairly large study, and the idea was that the primary endpoint would the monoclonal antibody to PCSK9, alirocumab, give better LDL lowering than the usual drug used for statin intolerance, which is ezetimibe. And of course it did. So that was the primary outcome, but the most interesting outcome of the trial were the results in the arm of the trial that had patients exposed again to a statin. So it was 2-2-1, two patients to alirocumab, 2 patients to ezetimibe, and then 1 patient to atorvastatin 20 milligrams. And one of the things that was seen in the trial is that there was a statistically significant difference between the number of patients complaining of treatment-emergent adverse events related to muscle between the atorvastatin group and the alirocumab group. So alirocumab did better at preventing muscle intolerance. And finally, at the end of the trial, the open label period, and here, once you got away from the fear that the patients had of maybe they were on, because it was double-blind for 6 months, the fear that they were on the atorvastatin, then they tolerated the alirocumab and the ezetimibe. Well, they weren't on ezetimibe at that time. They were on the anti-PCSK9. They tolerated that much better. So it showed a very strong psychological component to statin intolerance. It showed not a very large difference between patients taking the atorvastatin group and the patients taking alirocumab. In fact, there were 32.5% of those on alirocumab were feeling muscle side effects. Only 16% discontinued, as opposed to 45% taking atorvastatin had muscle side effects, and among them, 22% discontinued. So you had the great majority of patients re-exposed to a statin who actually tolerated the statin for 6 months at a fairly high dose. And so we learn a lot. We're going to learn a lot from it.
Great. And that was one of the talking points that came up after the presentation, was up to 75% of patients who were quote-unquote statin intolerant were able to tolerate the statin, atorvastatin in the trial.
Yeah, I think it was perhaps somewhere around 75%. Okay. What we're talking about there is that 22% of the patients on atorvastatin discontinued because of muscle-related adverse events. Now, there were other patients who discontinued with other types of adverse events, and there were some patients who discontinued without regard to adverse events. So I'm not sure it was 75%, but it's not too far from that.
Okay. And just one final question for you, for people who are watching this interview and reading through the results themselves, what should be the take-home for their practice? Would this change your treatment of statin-intolerant patients, or is this preliminary data that's setting us up for the outcomes data coming up?
Well, the take home is that now there is a study. There's a little bit of growing data of randomized double-blind comparisons of people who have complained of statin intolerance, and we're finding out that the majority of them probably aren't able to tell if they're taking a statin or not. I don't know whether it's going to be truly 75% or two-thirds of the patients who really are not going to be able to tell. And I'm not completely sure that we could say those patients might not have statin intolerance under other circumstances, under life stresses or something like that. We know that elite athletes, for example, rarely can take a statin but there could even be a psychological component to that as well. And the anti-PCSK9 inhibitors are going to fill a major void, because in practice surveys, you have 10 to 25% of patients who are prescribed statins who feel that they have had intolerable side effects.
Well, thank you for that very thoughtful discussion about the Odyssey Alternative trial. For more interviews like this, please visit us on the Duke Cardiology Fellows blog. Thank you again, Dr. Guyton.